talk about diabetic ketoacidosis in pregnancy. Now, this is an important topic which anybody can come across during clinical practice as well as in exams, and it's very easy to remember because it has got only three components which determine the diagnosis of DKA in pregnancy. DKA is diabetes, ketosis or ketonuria, and acidosis. So all these three comprise together the diagnostic criteria for DKA in pregnancy. So we'll take it one by one. Now the D is nothing but diabetes. So this beautiful lady, she's come with either a history of diabetes mellitus, or if you can see her tall long legs which symbolize the number 11, then you can remember that blood glucose level more than 11 millimoles per liter is the diagnostic criteria for diabetic ketoacidosis. So this lady with long legs symbolizing the number 11, or she has a history of diabetes mellitus, any of these will suffice the criteria for the D component of diabetic ketoacidosis. Now this lady is very fond of playing ketones. Okay, that means she will have ketones in the blood or in the urine. So one more thing which I want to say is all the numbers which are mentioned in this video will have a unit of mmol, millimoles per liter. Mmol per liter. Okay. Now this lady is very fond of playing ketones. That is, she has blood ketones levels of more than or equal to 3. So this golden McDonald number of 3, yes, 3, if we turn it a bit, it looks like McDonald. So this lady is playing ketones in a McD cafe. You can remember it that way. That means there are blood ketone levels of 3 millimoles per liter or more, and urine ketone levels of 3 or more. Both are 3 plus or more. So the value is 3 or more. In blood it is 3 millimoles per liter, and in urine ketone levels equal to or more than 3 plus. Now this girl, this diabetic girl, she has a grandmother who is 73 years old. This comprises the acidosis component of diabetic ketoacidosis. Now when we're talking about the acidosis component, we will talk about pH, and as I already said that the grandmother is 73 years old, so the venous pH for the diagnosis will be less than 7.3. Another important point to remember acidosis is, now this grandmother is going into a car. Now old lady, if she goes into a car, definitely we will take a car which is not of very high speed. It will take her slow and steady. So she has a car which has a mileage of 15, or it is running at a speed of 15 kilometers per hour. The number 15 is what we have to associate to this grandmother who is 73 years old. And what is this number 15, which is symbolizing the mileage or the speed of the car, is nothing but the bicarb level. So the bicarbonate level less than 15 millimoles per liter, less than 15 millimoles per liter, the bicarbonate level, and grandmother, that is the pH of 7.3. This signifies the diabetic ketoacidosis incomplete. That is, we have the diabetic component, the ketosis component, and the acidosis component. Here we have to remember 7.3 and less than 15. Here we have to remember more than equal to 3, more than equal to 3 plus. Here we have to remember 11 onwards. That is the level of glucose or a history of diabetes. So this lady who is sitting in a McD cafe, who has got very tall 11 kind of legs, and she has a history, or she has a history of diabetes, and in the McD she's playing ketones and has a grandmother who's 73 years old who's going into a car who has a mileage of less than 15 and it is running at a speed of maybe less than 15 kilometers per hour. The story is very, very easy, and it is essential to remember the diagnosis of DKA in pregnancy. Thank you.